some updated travel restrictions or guidance for the upcoming spring break. Could you just let us know what that is for?
I don't have that, but we'll have that shortly. But yes, we're gonna get some clarity out on that.
Is there anything that you can say about the genetic sequencing of this test? Like, I know that when they were tested in Washington, they were able to compare it with earlier tests that suggested the circulation for multiple weeks. Do we know anything more about where this strain of the virus?
And you have now exhausted my knowledge base. Who wants?
The short answer to that is no, not yet.
Yeah.
So yesterday there were some questions about whether schools would continue to take attendance into account in admissions decisions in middle and high schools, since that creates some tension with... Again,
we're just, yeah, and I'm not saying to be difficult. You asked it yesterday. We are dealing with other, I'm sorry, someone asked it yesterday. You look so similar. I'm sorry. I will get to that. That's not where we're at right now.
Guidance today, they tweeted that coronavirus-related absences will not impact current applications to middle and high schools.
Right.
I'm just wondering how that's possible, given that...
Okay, again, respectfully, I'm trying to be real with you. This is not where we're at right now. I'll happily get you an answer. We're dealing with much more central things than admissions issues right now.
Just a second schools question.
Sure.
The CDC officials have asked parents to ask districts about whether there are plans for remote learning in the event that one or more schools would have to close. Is that something that the DOE is prepared to do?
I think we're not there yet either, because the model we are working on right now does not involve school closures, but we'll look at everything if we end up in that situation. We're doing this in stages. Right now, we're dealing with what we have. We're doing, as you saw yesterday, more and more scenarios getting us out over the horizon, but I do not want people assuming outcomes right now. Right now, we have a situation where we are continuing with the work of the city, continuing with the work of our schools. We're not doing alternatives until we have to. Go ahead.
Mr. Mayor, in terms of a timeline for the Westchester case, do you know when he went to the hospital in Westchester, when he was moved to New York Presbyterian? And this may be further afield, but you might know also, we've heard that he traveled to Miami. Do you know the dates of departure and return for that trip?
My understanding is he did travel to Miami. Dimitri, on when realized sick, when went to the hospital in Westchester, when went to the hospital in New York City?
First became ill. So I'm Dimitri Deskalakis, the Deputy Commissioner of Disease Control, Department of Health. He first became ill on the 22nd of February. He then ultimately was admitted on the 27th and then was transferred from his hospital in Westchester to Columbia yesterday.
Do you have the dates of his travel to Miami?
I can say early February.
Early?
February.
Yav?
Mr. Mayor, I know the city doesn't want people panicking and seeking a test where it's not needed, but for the folks who have a legitimate reason to believe they might need to be tested, what should those folks do?
So thank God we now have the testing capacity. Again, it was a long time coming, but we have substantial testing capacity and we're building it out as we go. Folks should get to health care, and if they get to health care, and a healthcare provider says, yeah, you need a test, we're going to get them a test. So it's fine for someone to say, I'm worried I may have it, particularly very important, Yoav, and please, everyone, if they have been to an affected area, they need to say that first words out of their mouth. First words out of their mouth. I have been to fill in the blank place, and I have these symptoms. They will go to the front of the line, I assure you. And the assumption will be that they will be tested. But remember, the first thing that's done is to test for the more traditional, if you will, diseases. If that's a match, if you know immediately you've got one of the things we've known previously, well, that answers itself. If it turns out that you don't, we're going to get you tested. Who hasn't gone? Anna.
Mr. Mayor, you have repeatedly said that folks who don't have pre-existing conditions and who aren't necessarily older don't really have something to worry about. But the folks that have those actually include you. I believe you said recently you have asthma.
Yep.
And there's also thousands.
Mild asthma, but yes, asthma.
There's also thousands of people who smoke cigarettes, which
yep.
The commissioner said. So what do you say to people who have those conditions? Like, how do you reassure them since they are the ones at risk?
I will happily accept that status to make the point, is take it seriously. Don't ignore the symptoms. Now, I have not traveled to the affected areas, so I think if I were someone who had my exact profile and had traveled to the affected areas or had close contact with someone who did, and I started to show the slightest symptoms, I would get to healthcare immediately. But remember, Anna, the vast majority, even of those people, come through okay. So the reassurance is 80% plus of those who have been affected experience something like a cold or normal flu. They deal with it, they come out the other side, they go about their lives. For the 20%, the vast majority of the 20%, even if they need more advanced care, still come out of it and go on with their lives. For a much smaller percentage, there's a profound danger, absolutely. But like everything else in life, the faster you act, the better off you'll be. So the moment you have symptoms, go get help, which maximizes the chance that your situation could be addressed well, but also maximizes the chance that if, God forbid, you have it, it doesn't spread to other people.
Mr. Mayor?
Yes?
Mr. Mayor, at the beginning of this press conference, you mentioned that certain notifications were not made yet, so you couldn't give us
Correct.
information. Are those notifications about positive results, hospitalization, or fatality?
No, Lisa, nothing as dramatic as that. It's simply when we're dealing with organizations and institutions, before we say publicly they have some things they have to do to get ready internally to be able to explain to their own people what's going on, get their personnel in place. It's just good practice to be coordinated. But again, I think it'll be a very brief delay before we can fill in those blanks for you. You will, well ahead of your deadline, you will know what they are. Go ahead.
A quick question. Concerning the schools in Riverdale, 2 private Jewish schools that are closed, has the Department of Health been in contact with them? And just what kind of guidance are schools getting in terms of, I know you said there will be some other information coming out, but those schools are closed now. Were they told to
No.
they make that decision? Are people being tested?
No, very good question. So they made their own decision to close. It was not our guidance. Our guidance would be, all things being equal, keep going while we identify the specifics. Remember, in the case of the student at SAR, that student has no symptoms at this moment. Everyone, the urgency and the concern is real and honest. We all feel it. But facts do matter. So you have a student at this moment, no symptoms whatsoever. I would certainly never say to close the school. If they would choose to as a private institution, that's their choice, obviously. Health department has been there throughout the morning, contact with the principal. We're dealing with the heads of each organization. We're dealing on the ground with the folks who work there. We're doing that mapping to figure out who needs follow-up. Yes?
Mr. Mayor, should people be concerned about medical bills, and what if they are undocumented? How's the process for this?
So again, in a moment like this, the last thing people should worry about is the financial. Clearly, if someone has insurance, they have insurance. If they don't have insurance, we've said our public health system will always take care of people, and we've made that very clear. That includes undocumented people. So if someone does not know where to turn because they don't have insurance, or they may be undocumented, but they are fearful that they have the condition, they can reach out to 311 and get a location to go to. They can go to any New York City public hospital or clinic. Yes?
Because in Asia, we already see some patients without any symptoms, so do you think the public should be concerned about that?
We see patients what?
Without symptoms. They're still contagious.
Right, and what's your question then?
So should public worry about that, or does the city will take any precautions measures?
I'll start, and my colleagues will answer. Look, again, when dealing with a situation that is evolving and where we don't have perfect information, we want to, where we can be very specific, we're going to be very specific. So far, we have situations that are allowing us to be very specific. We know exactly who we're trying to find and what we need to do with them, and we're going to keep doing that. If we see something evolve that requires a bigger response, we'll be ready to do it. And this is a good moment for me to make clear, we are not, I don't think at this hour of this day we're anywhere near an emergency declaration. But obviously things could change. In the event that there is a need for emergency declaration, I have the ability as mayor to order institutions to be closed, to order public spaces to be closed and cleared, to restrict vehicle access, to initiate curfews, to modify labor contracts. There's a whole host of things I can do if we get to that point. But we are not there based on what we're seeing. So we're going to take this literally day by day, hour by hour, and see how it evolves. Go ahead.
sorry, I just want to make sure we're clear on the number of pending cases, because the
The number of,
pending cases.
we,
DOH page earlier this morning said there were 5 New York
okay,
City
I checked this and my colleagues will confirm, separate from the individuals we're talking about here, okay? Up to that point, 10 have been tested, 8 negative, 1 positive, the healthcare worker who went to Iran, female, 1 pending, the healthcare worker, husband of the woman who went to Iran, and we will have that result today. Can you all confirm that's accurate?
Yes. There was 5 on the DOH page.
So it should be only 1 pending. Yeah, yeah. So sometimes we have technical glitches, so I think that was just it. Yeah, it's 1 pending.
Currently 1.
Okay, go ahead.
I just wanted to follow up with Dr. Deskalakis. When you had mentioned that the individual from Westchester went to Lawrence Hospital and then was transferred to Crespi, was there a reason for that? Is there, like, do the city hospitals have some, like, greater capacity for treating this? Like, why move somebody? It seems like.
Great question. My understanding is it's actually he required a higher level of care and required different specialty sort of assistance. So that was the reason for the transfer.
When was he tested, and was this just today that he was tested?
I think we said that again, but could say it again, the sequence.
Correct.
Okay, yes.
Mr. Mayor, I'm just, we talked about facts being important. The Westchester County executive and a parent at the school said that the student there is actually a daughter, a 9th grade.
I'm sorry, at SAR?
Yeah. And
Okay, if I'm happy to be corrected if we're wrong. I've been told all morning it's a son.
My understanding is it's a male.
We'll confirm that. Yeah.
How did the woman who was most recently diagnosed, the healthcare worker, get from her home to Mount Sinai? Did she take an ambulance? She take a car?
We talked about this previously, private
car.
Private
Vehicle.
Right.
She got back from the airport and she got to the hospital?
Yep.
Correct.
Go ahead.
You mentioned there would be new procedures in place for cleaning schools. I'm just wondering if you could say how they're different from the previous.
We'll get that out to you today. It'll just be more intense cleaning, and we'll get that out to you today. Go ahead.
Thank you. Mr. Mayor, I think you said earlier that this man had been having respiratory symptoms on and off for about a month. With that said, when do you think he actually contracted this? Is it possible?
I don't think we know that, right? I mean, that's,
No, I didn't.
we don't know that. I think, but I do think there's an object lesson. I don't know this individual, and I mean this only as an example to everyone. At this moment in history, if you have the symptoms, go get medical care immediately. I think anyone who delays endangers themselves and others.
May I add?
Okay, hold on a sec. Go ahead.
So I just want to add, as the mayor announced yesterday, we now have put in place an early detection system where we have loosened the criteria by which someone gets tested. And in this particular situation, it's an exact example of having an individual who has severe pneumonia with no underlying reason for that pneumonia, and us wanting to rule out potential COVID-19. So it's an example of how the systems that we're putting in place to make sure that we're not missing people are starting to bear fruit already.
In Washington State, when the severe cases developed, it later emerged that there were, they suspect, hundreds and more who had not severe cases of illness. Is that what you think has happened here?
I don't think we have that indication right now. Again, I'm going to go by common sense, and the medical professionals can jump in. I think in Washington State, it appears, again, I'll try this, so listen carefully and correct as needed.
Yes, sir.
It appears there was a real nexus that was missed, that unfortunately, and talk about a place where there could be intimate contact and ongoing prolonged contact. We don't see that so far. I mean, we're obviously looking, but I don't think we have a parallel to that.
So you detect severe cases because they come to healthcare. And so the concern about community transmission, which is why we're having this conversation, is that there are less symptomatic people who are potentially in the community who could potentially transmit. So I think we have not demonstrated that, but that is the assumption under which we are working.
Okay, Jeff.
About the university student again.
Yep.
If he was showing symptoms, though, would that cause any more alarm than the situation you described, where people don't have to be as concerned if he was already showing symptoms?
Well, I'll start and say again, I think if a university student anywhere in this city just had normal flu-like symptoms and no nexus to travel and no family member who had travel, et cetera, you wouldn't, and again, healthy, no pre-existing conditions, that's exactly someone who, in the vast majority of cases, would come through fine. I think knowing that a family member has tested positive obviously changes everything. But I would say to everyone at this point, even if you're in the categories that are probably the strongest and the safest, if you have these symptoms, get to healthcare. If there's something about your situation that causes that provider to believe you need to be tested, you should get tested.
Is the city concerned now, as more cases begin to come out, about the system being overwhelmed at this point, with people being afraid going in for testing? What's the capacity?
We've talked about this a lot. The capacity obviously is vast. This is the biggest public health care network anywhere in the country by by a huge degree. We talked about previously, if we ended up in a situation where we had to isolate people, we told you guys this days ago, we have 1,200 beds we can make available without compromising our other healthcare services. We have, Mitch, how many total hospitals and clinics do you have?
We have 11 acute care hospitals, 5 skilled nursing facilities, and 60 other outpatient sites of care.
Right, so that's just H&H. So we have immense capacity. To your underlying question of whether there is a strain created if lots of people suddenly come in, and obviously the vast majority of them, thank God, will not have coronavirus, of course it creates a challenge. But we've made a strategic decision to say to people, we'd rather you come in. It only takes so long to assess someone. And this would be a good, I'm going to turn to Dimitri and say that test for things that are not coronavirus. What's the timeline on that? And what is it? Help people understand that.
So there's rapid viral panels that use similar technology to what we're using with coronavirus tests that looks for genetic material of the 26 most common viruses or bacteria that can cause respiratory illness. Of course, influenza is in there, RSV is in there. There's the list you'd expect. There are a couple of coronaviruses that are not this coronavirus that are also detected by that. Turnaround time depends on the lab. Places like H&H can often turn it around within 2 hours. Other places that use contract labs, there's also the transport time.
So but just tell literally, what does the doctor do? You're in the doctor's office. You have symptoms. What does the doctor do?
The doctor will stick an unpleasant swab in your nose and twist it, and then send it to the laboratory to do molecular testing.
That was awfully graphic.
It is true. I ask, I deliver. So it is a swab.
But that is job one. I mean, again, I'm gonna try and be the everyman narrator here, and the professionals will always correct me. Job one is, if you have the symptoms and you're with a healthcare professional, they want to see if it's just one of the many, many other things it typically is. And if you take that sample and then you find out, hopefully in a matter of hours, it is, for example, what would be the most common hits for normal diseases?
Today, influenza.
Yep. Right. So if you find out it is the flu, you can, again, I'm going to be painfully systematic and commonsensical here, and the doctors will help me. You go through that, comes back, it's the flu. By definition, you do not have coronavirus. True statement?
Correct.
Okay. That's where I'm trying to get to. So let's talk about it.
Not seen in any volume in the reports of coronavirus. So usually, at least, and also by our guidance from public health, that we're seeing another diagnosis then stops the evaluation.
So I'm going to pull that back and take Anna's question and work it through. We don't have perfect knowledge. Everyone, the entire medical community globally would agree we do not have perfect knowledge of coronavirus. Now, I'm listening to you guys. I'm listening to the wonderful accent of Anthony Fauci. If you get a hit for pneumonia, for all intents and purposes, it means you don't have coronavirus. Maybe there's some perverse exceptional case, but for all intents and purposes, if it's pneumonia, you don't have coronavirus. True?
That is true.
Okay. And could you give us another example of a typical disease it might be that's not coronavirus?
It's a long name. I'm sorry. Respiratory syncytial virus, very common in the community. RSV. Usually, people think about it in kids, but it happens in adults as well.
What do we call it? What do we think it is? A cough? I mean, what do we think?
Oh yeah, it's a cough. It's a cold.
Okay. So a cold. There we go. So to finish through this point, that initial test, which is not complex to give and comes back pretty quickly, if it rules out coronavirus, that's wonderful. And that's one less person we have to wonder about, and that person moves on, takes care of themselves next. So we want people coming in. When a medical provider thinks, nope, I want a coronavirus test on this, then we go get the test.
The schools questions, because, you know, a lot of people obviously have questions about the DOE policy. Are they hammering that out? Why didn't someone from the DOE come here? Because I know you say later on, but, you know.
What specific question are you looking at?
The updated travel advisory, if there's going to affect admissions, and if there's anything more on.
Again, this is just perfectly fair questions. Just everyone has to understand, having been through these things, we're trying to do what we think are the most important things first. We're going to get to those things quickly. But right now, it is taking care of the things that are about basic health and staying ahead of all of that. We will have answers for you in the course of the day.
The test, just going back to the scenario where we're testing, if the test comes back negative for all the common illnesses, is it an automatic kick up to the health department to test for COVID as a precaution? Or does the healthcare provider have to request that? I mean, I've seen emails from family practitioners where, like, if you don't have severe illness, stay at home. We don't have the capacity to take everyone in with a sniffle right now.
No, that's it. But you asked, that is a true statement on one level, except you varied the scenario there by saying they tested and found it wasn't all the typical things. Look, again, as we build out our testing capacity, we want to test more people who need it. So I would argue if someone comes in and we have found that we can't identify it as one of the other things, and now we know community spread is a possibility, we're going to be testing whenever possible, abundance of caution.
Family practitioners to be requesting the testing in all this.
I want more opportunity to define what's going on. That's good for everyone. But again, I want to put the horse before the cart. We have a really easy test to figure out if it's all the things it usually is. And again, doctors, I think we would generally find by giving that really easy test, it will usually be the things it usually is, right? The vast majority of the time. So, okay.
With regards to the symptoms, earlier the Westchester County Executive held a press conference that if you feel like you have the symptoms, don't go to the urgent care, don't go to the hospital because you could spread it. Earlier you said you should go to urgent care.
I have a very strong view. We've all worked this through, and the public health folks will be the first to say that they are worried about too many patients coming in, and they are worried about making sure there's good protocols when someone goes for health care. But we made a strategic decision to say to people, get to health care. Because it's too hard for people to understand. I don't blame them. In the most diverse city on earth, hundreds of languages, people dealing with busy lives and schedules and challenges, we want one simple message: get to health care. Let me, Deputy Mayor, I'll jump in a second. We will sort it out. So you got a private doctor, that's great. Urgent care, that's great. Hospital is not the first go-to. Go to something simpler than a hospital whenever humanly possible. Call ahead when you can to maximize the protocols. But I know too many people, myself included, who hesitate when we're sick, come up with some reason not to go get help. Oh, you know, I'll do it tomorrow. Oh, you know, I'll do it when I have a chance. That's not what we should be doing in this situation. I want people getting to health care. We have a massive healthcare apparatus. We can handle it. One message. This is whatever Westchester wants to do is up to Westchester. This is the New York City message. Deputy Mayor.
The mayor said it yesterday, and he just repeated it, 20 minutes ago. The key point here is the nexus. Where you have to start is if you have symptoms and if you travel to any of these affected countries, or you are in close contact with anyone who has, that's where you really want to go. When anybody says don't come because you're going to overwhelm, hopefully he means for the others that don't have that strong nexus.
That's a very important point. If you have the symptoms and you have a nexus to travel to the affected countries, you're not only wrong to hesitate, you could be putting other people in danger. You just need to get to healthcare immediately. Lisa.
Mr. Mayor, could we just get some clarity on prevention and cleaning? Because you say the subways obviously are getting cleaned with bleach. You can't use bleach in a lot of homes if you have small children or people with breathing issues or asthma. In terms of prevention, maybe the medical experts could give us some help with close quarters.
I'm turning to Dr. Barbeau because her line yesterday was a very good one about your new best friend, so I think you should repeat it.
So Everything that we have talked about before in terms of prevention still holds. So it's the basic messages of hand washing, covering your mouth and your nose when you cough. And if you're not close to a water source, then you should by all means use alcohol-based hand sanitizers. In terms of the cleaning for homes, for institutions, I think it's always good practice to use thorough cleaning, but we don't want people to have a false sense of security that if that cleaning is done, it absolves them of the responsibility to continue washing their hands.
Right. Okay, we'll do a few more. And again, guys, there's going to be more updates from whatever combination of us later in the day. So just to say, this is not the last you're going to hear of us. Go ahead.
Conversations with the TLC about, keeping Ubers and taxis sanitized. I know that, casual contact is not what's going to drive this, but since we are doing that with subways and buses, is there anything you guys are doing with regards to taxis?
So we'll have update on that. Basically, every agency has been charged with figuring out what they have to do here, not only for those that they serve in the public, but for their own employees as well. All of that, there's been guidance given out. Agencies are developing those plans, putting them into action. I don't have the TLC guidance in front of me, but we'll get that to you. Go ahead.
We were talking about colleges, and we know college dorms are petri dishes for a variety of
That is a true statement.
purposes. And I was curious if, Dr. Barber, are you working with any of like the on-campus clinics for students coming in and thinking they might have mono, they might have the flu, they might have coronavirus, and using those results for early detection, or is that just not included in that process?
So right now, we're starting, as we said yesterday, with 3 major hospital systems, including H&H, and then we'll be working to include all of them. The thing to note here that we haven't yet talked about is that the private sector is also working on having access to testing, and so we anticipate that that will also come online soon, which will increase the city's capacity to do testing even more.
You might send a result to the public health laboratories versus, like, I talked to Northwell yesterday and they're hoping to get online within like the next week or so. And so I'm kind of curious, like, how does that work from the city standpoint and saying, okay, we're going to send this out to a private lab versus the state lab versus the city lab?
Well, first and foremost, we want providers to send them to us now because we have the capacity. But once providers, commercial labs get their capacity, or academic labs, we want there to be as easy a road to getting tested, to the mayor's point,
Easy
as
and
possible.
fast.
Yeah.
Okay, guys, we're wrapping up. I got 3. Julia.
Just real quick, it's Columbia Presbyterian on 168th Street where the Westchester case?
Correct? Correct.
Thank
Go ahead.
In terms of the disease detectives, do they ever track something like the flu? And is there a threshold where there's so many cases that they can't possibly keep trying to track all the millions of contacts?
So flu is a good example. So when a disease is rare and it is a public health consequence, they can pursue. When a disease, even like the flu, is not rare, then it becomes not possible to do that same level. So for instance, we do not track every flu case in New York City. We do close surveillance of the flu cases, and we know what's happening in the city sort of really day by day for influenza.
Okay, we're finishing. 1, 2, done. Go.
City's testing capacity came online yesterday. Do you know how many people have been tested?
Do we have that, or we'll get back to them?
We'll ultimately update on the website. A person under investigation equals a test, so we haven't updated yet.
Just want to get clarity on the 2 sons. I know one is showing symptoms. You said they're both isolated. And the other one isn't? Is this going to be like the healthcare worker and the husband that you're expecting the one that's not symptomatic yet to eventually become symptomatic?
Yeah, I mean, I think those details will become more evident as the day goes on, but we will work with the family to keep them together as much as possible. Yeah.
Are they being kept together now?
Yeah, as I said, they're at the home in Westchester, the mom and the 2 sons. Okay?
So the mom is with the
Yes, yes.
Is there anyone else in that household?
That's all we know of. Thanks, everyone.
Do you know when the next presser will be with information?